Good afternoon from Pakistan, Islamabad, to all my audience who is all over the world and in India. Today's our topic is stockpiling of antiviral medications, and argument is that we should be stockpiling COVID-19 antivirals now to protect us for the future waves. I will be speaking against it. Let's first talk or discuss what is stockpile, because sometimes people get a little bit confused about stockpiling and just stocks on the hand. So stockpile is a large accumulated stock of goods or materials, especially one held in reserve for use at time of shortage or other emergencies. So these are the stocks which will not be used until there is an emergency. While stock mean the goods or merchandise which are kept on the premises of a shop or a store or for routine distribution. So that's a bit difference from a stockpile. And stockpile is not used until there is emergency. Stock is regularly used and replenished as your needs are. And just to give you a bigger example, that the food in our pantry is actually stock in our kitchen pantry. So there will be stock for some items for a few weeks, and for example in Pakistan, India, most people will buy rice in quantity which will last them couple of months. Similarly, flour is bought like for a month use or that time of period. But if we look at stockpiles, stockpiled is the food will be bought, especially in those tin forms that it can stay as long as it survive as long as it possible, but they are not used. So stockpiles are kept for emergency purposes. So what are the possible benefits? Because if I have to make an argument against stockpiling of antivirals for COVID-19, first, broadly I should be aware of the counter arguments that why we should be stockpiling. And that's the number one argument in its favor is that it provide treatments until vaccines are available for a new disease or for the current disease, for the ongoing disease. It may reduce mortality and morbidity, and thus in result there will be less strain on the health system, and there will be, because you are controlling mortality and morbidity, there will be less panic in the population. But there are major problems of stockpiling, and what are these? Number one, it's extremely expensive to procure antivirals. That even a small country may need billions of dollars just to procure, a certain amount of antivirals, and that's very true for COVID-19. The countries have different countries, even smaller countries have spent billions of dollars on that procurement. The second problem with it is that it has a short shelf life in most of the antivirals, which is a huge waste of resources, because this is, again, remember, this is a stockpile you are not using. This is not your monthly or 3 monthly supplies of your hospitals. These are the stocks which are kept for emergency purposes. And in my public health life, I have seen even in influenza antivirals that huge wastage countries have to suffer, because they bought the stockpiles of antivirals for avian influenza. That was a few years back. The country was keeping certain stockpiles, and because there was no pandemic, so that gone to waste. So again, country to country, for countries like us, that's a huge strain on our resources. And the third and a major reason of which is against stockpiling is that it's seriously determinant to equity. And I will give you an example. Normally, we have seen in COVID-19, both in vaccines and medicines, that as soon as they became available, the rich countries placed orders on them. And they bought unnecessary amounts of those vaccines and medicines which they were not able to use until they got expired. And we have seen this problem in many Western countries that, they bought so much vaccines which pretty much went to waste, or then at the last minute they donated to some poor countries in the last period of their close to expiry. That's wrong, because when the rich countries pay the price and take away all the medicines or antivirals from the market for the stockpiling purposes, that means the poor countries do not have access to those medicines which could be life-saving to their population when the next COVID-19 waves hits with a new variant which may be more dangerous or more lethal. So I think the concept of stockpiling actually goes very much against the equity we talk about, and especially for the poor countries. And we have not seen, not only in this vaccines and antivirals for COVID-19, we saw this for the even simple masks, because the rich countries again were paying huge amount of money for the N95 masks and other those kind of things, and poor countries couldn't find them in the market. So I think that's a major reason why I'm not favoring COVID as stockpiling of COVID-19. But the biggest problem is the antivirus. Even if you stockpile, they may be benefit to you for certain extent, but resistance could easily develop in them. This is a known phenomena, and as someone has said, that even though the coronavirus has not developed resistance to the most effective antiviral, which is Paxlovid, but how long that can last? And that's what someone wrote, that resistance is the hobgoblin of the antiviral medicines. Even with antivirals as effective as Paxlovid, after doctors deployed nearly every new virus-killing infusion or pill in the history, strains popped up either immediately or eventually with the machinery wrapped in just the right way to evade the threat. So basically, the history tells us that it doesn't matter, every antibiotic or antivirals eventually is going to see resistance by the microorganisms. So the question raises is that you have bought billions of dollars of antivirals for your stockpiling, taking the opportunity for poor countries to buy those as a stock, a running stock for their own health system, and thus you are threatening the lives of the population in the developing countries. But for what reason? Because maybe the next wave when comes of COVID-19, it will be resistant to existing antivirals, and that's not going to something new phenomena. That's actually a routine phenomena. So biggest problem which I feel is with stockpiling is that it's a clinical solution to a public health problem. So until now I was giving you the materialistic or reasons that why stockpiling is bad, but now I think is the philosophical argument against stockpiling. Pandemics are not a clinical problem. They have clinical issues, but they are public health problems. So its solutions should come from the public health side. That should be the priority when you're coming up with the solutions, that how you're going to control a pandemic or epidemic. And the clinical solutions will help you to evolve that strategy, overall strategy of controlling our pandemic. But you cannot control a pandemic, which we have seen in COVID-19, by just focusing on clinical solutions. And as we have discussed this, that how confident we could be that the next pandemic could be treated by stockpiles, antivirals, because there could be a new variant, a resistant variant, and so all the stocks you have bought will be staying waste. So what we should do? So according to the public health perspective, or my personal opinion is, best use of resources is by strengthening your public health system. If you have to spend $3 billion to stockpile an antiviral for the next wave, I think it's better to use most of its resources to strengthen your public health system, improving your disease surveillance system so you could pick the next wave much quicker, so that you can deploy field epidemiologist team to respond to outbreaks, keeping them localized so they don't become epidemics and pandemics. You need to strengthen public health laboratory systems to identify those new variants much quicker than that has been in the COVID-19. So we need to strengthen our alert system and response system for the new wave of COVID-19 or even a new pandemic of other disease. So these will be the best use of resources for your money. I wrote like a year back in my regular op-ed series, and I said, these were my words, which I said, rich countries cannot build a wall of vaccinations. And for here, I will add, they cannot build a wall of antivirals around their borders, as if transmission is happening somewhere else. Eventually, a new variant will breach these walls and make those populations vulnerable again. So it doesn't matter how much stockpiled medicines you have, how much stockpiled vaccines you have. If you are not working in a global public health perspective, eventually a new variant is gonna knock on your doors and threaten your population, and it will be it could be more resistant to existing antivirals. It could be more lethal, a new variant. So all your preparation will be, or investment have much lesser value. So if you want to work and make sure that your population in India or Pakistan or US or UK is protected from the public health dangers of pandemic, COVID-19 next waves, we all need to work together. You need to leave this idea of fighting a virus in our own territory. We need all to work together to control this. So next pandemic or the next wave of COVID-19, we need to strengthen epidemiology, and that was the most neglected field before the epidemic hits us. And we need to strengthen epidemiology to do what? We need to make sure that we clearly know how the virus is being transmitted. And for COVID-19, international bodies struggled for more than 1.5 years before admitting that it is the airborne. That's how that is the major route of transmission, that how the virus is being transmitted. And I think that reason alone has costed us in the millions of lives and sickness, because we were unable to clarify early enough. Even though the data was there, the information was there, but we were not able to adopt that understanding that this could be airborne, and that cost us human lives. And what are the risk factors? What are the vulnerable group? Because that's how you basically, what we call is able to protect your population without having huge stockpiles of antivirals, by answering those questions. So antiviral and vaccines, we need to invest on this. So don't consider that I'm against the antivirals or vaccines. We need to have ongoing research on antivirals, and already it is being done. Many of you are virologists, so you know this much better than myself, that the next wave of new vaccines which people are developing are more generic in their how they act. Similarly, the antivirus on which the work is being done have a more wider spectrum of action as compared to the existing COVID-19 antivirals. So we need to have also coordinated system of vaccine and antiviral trials, so that we can modify our strategy and pick the best weapon by a coordinated way of the trials, and fair and equitable system of vaccine and antiviral deployments. As I said earlier, you cannot beat COVID-19 or any other microorganism by working alone in your own national borders. With this, I will thank you for your time and will be happy to answer any questions you may have later.